Clinical postings. Let's dissect this term and understand its meaning first. Clinics plus postings. This may sound dumb, but just bear with me. Clinical postings are when the budding medical student is expected to step into the OPD, or wards, with an intent to learn by observation and gain supervised hands-on experience. Starting your first clinical posting as a nurse can be both exciting and overwhelming. Trust me, if you're about to step into the ward for the first time, this video will save you from unnecessary stress and surprises. Here are some things you might wish you knew beforehand. 1. You are expected to have some prior knowledge about the ward or the department of which you are posted to. Having some prior knowledge at hand is an unsung rule if you actually wish to extract the best out of the postings. For instance, you are posted to the outpatient department, OPD. You should read online about OPD and what the nurses in OPD do. This will give a general knowledge of what to expect. 2. Respect goes a long way. One thing I wish I knew earlier is how much respect and attitude matter. Always stand up whenever you see a nurse enter your ward. Very important. Greet the nurses, doctors, patients, cleaners, everyone. A simple good morning, ma, or good afternoon, sir, can pen doors for you. It makes you approachable, and you'll find seniors more willing to guide you. 3. Show up on time. Arriving early at the clinicals makes you take charge of your environment. By all means, ensure to be early for clinicals. 4. Take notes. Get a special note to be used for all your clinicals. This would serve as your personal guide for any procedure and lessons you learn. 5. Be confident. Skills are important, but so is confidence. Though clinicals were all about showing off my practical skills, like bed making or taking vital signs. But what actually matters more is confidence and willingness to learn. Even if you make mistakes, show that you are ready to correct them. Confidence makes patients trust you too. 6. Observation is key. It's said that oceans of knowledge can be accumulated by observation and pure curious questioning. Your first clinical posting will require you to learn by observation. Never claim to know more than your colleagues. First things first, observe and know the rationale behind every action. 7. Apply the theoretical knowledge of what you have read or have been taught and see how it translates to practical life and evidence-based medicine. Make your personal findings and research on any condition you come across in the hospital. Let's understand this using an example from my personal experience. There was a 56-year-old woman in the medicine ward suffering from chronic hypertension-induced systolic heart failure and Kaplan syndrome. While the interns asked us to take her history and give out possible differential, I noticed something strange. She had been hooked up to the 0.9% normal saline 4 for the last 3 days. She had visible edema on her palms and lower extremities. Since I had read congestive heart failure beforehand, I knew that she definitely shouldn't be started on any for fluids given her condition. I immediately contacted the sister on duty and she questioned to stop for fluids immediately. So, you see, if I didn't know the pathophysiology of congestive heart failure CHF, I would have just moved to the adjacent bed to continue my history taking formalities. 8. Learn from your seniors. Seniors are your best friends during clinical postings. Throw as many questions you want. Question everything. Learn all procedures and interventions taught to you, and take notes of the same. 9. Practice taking a perfect history. History taking is a vital tool for nursing interventions. See how it's done, practice it, and master it. You can do this by utilizing the consulting room. When you are opportune to stay in the consulting room, ensure to learn how history taking is done. 10. Communication is key. Effective communication with patients, families, and the healthcare team is essential. For those who would be posted to the OPD or antenatal, you will be given opportunity to educate your patients. You need to know how to communicate. Just be confident and ditch out what you know slowly and accurately. 11. Emotional resilience. Prepare for emotional challenges. You may see scenarios that makes you emotional. It's normal to face difficult situations. Developing coping strategies is important. 12. Hands-on skills. Familiarize yourself with basic procedures and skills. Practice as much as you can, whether it's for insertion, wound care, or basic life support. 13. Documentation. Understand the importance of accurate and timely documentation. It's crucial for patient safety and legal reasons. 14. Team dynamics. Learn how to work as part of a team. Each member plays a role, and collaboration enhances patient care. 15. Self-care. Take care of your own physical and mental health. Nursing can be demanding, so make time for self-care. 16. Seek feedback. Don't be afraid to ask for feedback from peers and mentors. It's a valuable way to grow and improve. 17. Stay curious. Keep a mindset of continuous learning. Every day at Clinicals presents new challenges and opportunities for growth. 18. Know your resources. Familiarize yourself with the hospital layout, available resources. You can get your own face mask, hand gloves, and sanitizers to avoid nosocomial infections. 19. Regulatory and ethical guidelines. Understand the ethical and legal responsibilities of nursing practice, including patient confidentiality and informed consent. Take consent for any procedure and explain procedure to patient as you carry out the procedure. Do not appear to be naive. You can use words like "I will confirm" and "get back to you" if you are not sure of what the patient is asking. In conclusion, be confident patients don't care if you're just a student. They care if you see them, and they are ready to hear you talk. Every experience is a learning opportunity. Embrace the challenges and remember that it's okay to ask for help. Ask questions always. Don't do anything you're not sure of. Your first clinical posting is just the beginning of your nursing journey. You remember these points. I promise your first posting will be a lot smoother than mine was. Thank you so much for watching, and if you found this helpful, don't forget to like, share with your fellow student nurses, and subscribe for more nursing tips. See you at the top.